Hello, in this video I want to discuss the problem of pain and sleep issues in chronic fatigue. Simply I want to bring an encouragement by showing you how herbs can adapt to the symptoms patterns of your sleep issues and tackle the pain at the same time. Sleep is tremendously important for chronic fatigue syndrome. It is the only aspect that could bring back health in chronic fatigue. If the sleep is not working, please don't blame the sleep. It might be that it's unrefreshing, but that could be because your body is doing many millions of other things to restore itself that makes you tired in the morning when you wake up, or keeps you awake at night while instead you would like to sleep. The usual challenges that most people experience, we know that is like difficulty on falling asleep, waking up and never going to bed ever, having sleep apnea, those the terrifying sensation of being scared to fall asleep, being too tired to fall asleep, and then waking up suddenly, which basically is a sort of a traumatic sleep experience. And obviously then the sleep is unrefreshing, so when you wake up you feel even more worse than when you started going to bed. Then we have the frustrating feeling that when you experience pain when you are in bed trying to sleep, you cannot sleep. So either the pain is so powerful that it really keeps you awake, or you start fidgeting, changing position, because a position can last for very little. And those are all things that affect dramatically sleep. Then pain does not help you to turn off your mind, and therefore the combination of pain, fidgeting, and staying awake for that, and your mind being anxious and stressed about this, you find yourself that you don't sleep. When talking with a lot of clients and people in the groups, I understood how fear is terrifying, because how can I solve my problem if I cannot even sleep? Even for just one night of non-sleep, you can feel knackered for the rest of the 2 days, so on. And when you're really debilitated by chronic fatigue, that can be very, very serious and lasting much longer than 2 days. The questions are where someone can even start to fix this problem, and how do I know this? How can I solve my problems? Why this is happening to me as well? You know at this point probably my point of view that I discussed in the previous 2 videos, that the fluids are at the basis of chronic fatigue syndrome. The fluids run your body, the extracellular matrix, the interstitial fluids. So if you get a painkiller and that reduces the pain, however, that creates further intoxication that could give more job to your body, and so that could affect sleep. So in a way, you cannot allow the extra burden. You have to play simple, play gentle. Everything has to go in and out of your body smoothly, gently. But at the same time, you need to figure out what could make it work deeply and change from inside. And here comes the herbs. Herbs are not a burden to the body. They contain phytochemicals that are easily absorbed and eliminated by the body. They contain minerals and electrolytes that contribute to nourish your body. Herbs contain medicinal constituents that are able to improve and reorganize the fluids of our body according to the specific action of each herb. Here I want to give you an example. Take for example the herb Eschscholzia californica. It is a painkiller that makes you drowsy. So if you take it before going to bed, it is able to quickly reduce the pain, but also to make you feel drowsy so that you want to go to bed and fall asleep. Take the herb Passiflora. Passiflora is a herb that is very, very good with people with anxious mind, always overthinking, always hyperactive with a mind that they can never turn it off. You basically lower the level of your anxiety, and you can take it during the day because it doesn't make you drowsy. But imagine you take Eschscholzia and Passiflora at the same time in a particular dosage, so that you are able to reduce your anxiety level, be drowsy, and reduce the level of pain. That could be a help for a person that, for example, suffer of back pain that makes you fidgety at night, and when he stays awake he keeps overthinking about the problem. So the different herbs and the different combination in the different dosages of the herbs are a powerful tool to adapt to the symptoms of your illness, to the patterns of symptoms of your illness. So to recap, what about sleep? Sleep is important for recovery and restoring health in all your body fluids, tissues and organs. We need to allow sleep to happen. We need to avoid intoxication, side effects banned. We need to avoid vicious cycles where to treat something you create other problem elsewhere in the fluids. We need to avoid brain fog. You cannot tolerate to be half of your mental capacity because you want to be lucid. You want to know and experience how the herbs are treating you and healing you to bring you back in health. What do you want to have in a therapy? Gentle action but deeply healing. You want it to be cleansing. You want to be nourishing. You want it to be restoring the threshold of pain and improve the immune system. You want it to act deeply in the organization of your extracellular matrix. And finally, we understood that herbal medicines are able to adjust to the symptoms pattern that you present so that they can intervene with subtle differences in the most effective way. Herbs, finally, that can help you with cleansing and detoxing without creating further burden to your body. And whatever happens, however you feel in one day, you can always start the day tomorrow and back again on the herbs because they are not creating intoxication, saturation and vicious cycles. Thank you.